Hi everyone, welcome to another Gypsy Nurse Live. I'm Rachel, the online community manager for the Gypsy Nurse. Today we are discussing a wonderful topic brought to you by Gifted Healthcare. They would like to share with our community how to be a community leader. Gifted couldn't have found a better person for this topic than our special guest today. Her name is Erica Rogers, and she's an RN that has leveraged travel nursing to follow her passions, which includes starting her own humanitarian aid and relief organization and serving as a leader on public health committees across the nation. In this live event, Erica will share her nursing journey and discuss how travel nursing offers endless opportunities to provide care at the bedside and beyond, learn how to stay engaged as a caregiver, become a community leader on any travel nursing assignment. No matter where you go, you can do this. Fighting nursing burnout, which is super important right now, and participate in the effort to end COVID-19 pandemic. So it is my honor to bring on Erica. Hi, Erica. Thank you so much for joining us.
Thank you. Thank you so much for having me. Thank you, Gypsy Nurse. Thank you, Gifted Health, for sponsoring this segment. And thank you to all the nurses that are out here working day in and day out to try to fight the most catastrophic thing that we probably will ever face in our career, this COVID-19 pandemic. I am there on the front lines with you. We are all fighting together, and prayerfully soon we'll be able to see a better day and a new normal. I will be here talking to you about travel nursing and public health and how to be a community leader. And as Rachel said, leverage our career as a travel nurse, or even if you're not a travel nurse, if you're a staff nurse, how to leverage your voice as a nurse to be a trusted community leader. On the next slide, I will talk about purpose and how nursing is not only a profession, nursing is a calling. And I feel like, and I'm sure as everyone else who is in the profession feels, that it takes a special person, it takes a special heart, and it takes special grit and bear to be able to undergo the challenges that we undergo as nurses and to be able to face society as we face society. So I like to follow the mantra in my own life, as Chadwick Boseman, rest in peace, has said, that what purpose is the essential element of who you are. It is the reason you are on the planet at this particular time in history. Your very existence is wrapped up in the things that you are here on this earth to fulfill. So I've taken that mantra on next to start a nonprofit organization that I feel is my purpose, and travel nursing has been the gateway for me to be able to do it and do it successfully and reach many people abroad and local. On the next slide, I'll talk to you about how it is important to choose a nursing agency that acts as a catalyst to your calling. As we all know, nurses are innovators, influencers, change makers, and most of all, we are trusted voices in the community. So it's very important that we use our voice to be able to reach as many people as we can to change the trajectory of health, not only local, but abroad, and to see it from a different lens. I can remember speaking to my nurse recruiter, Kate Twombly. She is a nurse recruiter for Gifted Healthcare, and I am a registered nurse under Gifted Healthcare. And after our first conversation, we talked about, me coming back home because it was certain things that I wanted to do in Louisiana with public health and certain needs that I saw that needed to be met. And after our introduction, we talked about a couple of jobs. Kate asked me, she was like, "So what is it? What is this organization that you're talking about?" I said, "Well, it's an organization that I founded. It's called Braveheart Foundation." And from there, she was very interested, not only at my resume that I presented to become a nurse and, to fulfill a need in a hospital, but she also was interested in what I can do to fulfill the needs in the community. And for that, I am forever thankful. And I think it is so important whenever you are choosing an agency that is a tell-all sign of peace and, your peace and your sanity of how you will be on the trajectory of your nursing assignment while you're trying to balance the other things that you're passionate about in life. On the next slide, we will talk about gifted healthcare. This is the reason why I chose gifted healthcare, is because what its mission states: we are gifted clinicians, and we also provide compassionate care. And not only do the clinicians provide compassionate care, the recruiters are very compassionate in knowing what your passion is and how they can be a catalyst for you to be able to provide care with the passion that lies within you. On the next slide, we will talk about how I decided to go beyond the walls of the hospital. I've been a registered nurse for 12 years now, long time. And I was taking care of a patient. My first job was at MD Anderson Cancer Center, and I was taking care of a very special patient to me, who I stayed in touch with after, she was discharged from the hospital, and her family. She had a very rare cancer. And after about a year of treatment, she ended up passing away. But I always remember her telling me, Erica, you're called to go beyond this. Like this, you just being here at the bedside is more than what you should be doing. And oh, wow, I was thinking, well, what else am I supposed to be doing? I'm thinking, well, I mean, should I go back to school? Should I be a doctor? Like, what is she talking about? But as I started to think about it more, and that resonated so deep in my spirit. I still remember Miss Lowry speaking to me about that. It was more about your passion. And Braveheart Foundation has been the passion project that has really helped me overcome nurse burnout, which I'm sure a lot of us face. Braveheart Foundation was birthed in Houston, Texas, with that patient that I just spoke to you about, as a peer-to-peer support group for patients that would come into the cancer center with a terminal illness, and they would support one another throughout the journey. Well, when I came back to Louisiana after a traumatic time, and we all know that a lot of purpose, a lot of passion, and a lot of dreams are sometimes birthed out of dark periods in your life. So I went back to Louisiana after a dark period, and I wanted to do more. I wanted to go out of the country, and I wanted to get a different perspective of what healthcare looks like outside of the United States. So I embarked upon a trip to Uganda with a group of clinicians from Houston. And we traveled to Uganda, and we set up medical clinics throughout the entire country. Well, after that trip in 2014, the group dissipated. I still do not have contact with the person who facilitated the trip. It was just like he was an angel that dropped out of the sky that put this purpose in my lap. So after that first trip in 2014, I kept in touch with the group that I met in Uganda, and they kept asking, well, Sister Erica, are you going to come back? And me, I was in my early 20s. I'm thinking, what do I know about going to another country by myself, facilitating a trip and setting up medical clinics? Well, never count yourself out in your ability to do something great, because I was empowered through those same people to learn how to do it. And I was able in 2015 bring my own group of clinicians from New Orleans, about 5 of us, 3 ER nurses, 2 critical care nurses, and we utilized the doctors and dentists that we use in Uganda. And we set up our own clinics, and we did our own first mission trip. And since then, we have been going every year. Amid COVID, we have not been able to go, but we will start to go back in 2022, hopefully, to do a lot of COVID awareness and mitigation teaching in the country. So next, we'll talk more about the collaborations. And even if, you do have a dream of, or a vision of doing any sort of entrepreneurial venture or nonprofit organization, or whatever it is that your passion is, that kind of gives you a way out of the stressors, the everyday stressors of the hospital, of being a nurse at the bedside, or being a case manager, a nurse practitioner, or whatever field it is that you are in on your day-to-day, and it's something else that you're passionate about, just always know that where your vision is, provision will follow. And through our mission trips, Dreamville Foundation, that was founded by the rapper J. Cole, sought us out because of our work in Africa. They were doing a podcast about a lot of political unrest that was going on in Kampala, Uganda. And, without me knowing, I had no idea that they were following. And I got an email about the work that we were doing, and a lot of the proceeds that they made from that podcast came to us, and that allowed us to broaden our scope when it came down to the work that we were doing in Uganda. And I think all of the collaborations, all of the opportunities that we have gained from that. Next slide, we'll talk about how we are pivotal right now in this day and age to combat against COVID-19. Now, we all know that, I've worked the front lines since March. I worked my first assignment with Gifted Healthcare in New Orleans the week after the first case was acknowledged in the city. And when I tell you, as I know that you all know, everybody's hospital was flooded with COVID patients. It was something like I've never seen before. If it was to be compared to nursing during a war, I guess that's what we would compare it to. Resources were there, but they were scarce. We were all scared. We were all faced with our biggest fear. A lot of times the way that I explain to people when I, do awareness talks about COVID is that, us nurses, we saw people, in the shadow of their life being gone and walking them into the light of death. And that is something that I will never forget, how many times that I've had to do that. I've had to stand by the sides of people, such as all of us that have done it, and walk people into that next transition, even if they weren't ready. So us as nurses, we've seen the downpour. We've seen how dismal the world was. We've seen the medical and the nursing community be stretched to our highest capacity. And as nurses, like I said in the beginning of our presentation, our voices are heard. We are trusted voices in the community. And it is very important that we use our voices to let people know what has happened and what can happen, if COVID-19 is transmitted. On the next slide, well, we can stay on this slide. We talked about, I talk about how we are pivotal, and what I have done, because I've seen the downpour and I've seen what has happened. I took it upon myself with the organization to galvanize nurses that I've worked with throughout the pandemic to start a vaccination parade. Now, not everybody is ready to be vaccinated. I do encourage it, but not everybody is ready. And we're not ones to, talk against you if you don't want to get vaccinated. But what I do encourage nurses to use their voice to say is, these are the ways that you can mitigate. You can keep your mask on, you can hand wash, you can keep a social distance. Whenever you are vaccinated, this is a hotline that you can reach to ask questions about different things that you may be apprehensive about. But most importantly, being tested and knowing your status, to me, is the main key here if you're not ready to be vaccinated. And even if you are vaccinated, tell a friend, be the voice to a family member that may be scared or apprehensive, that, this is a community effort. This is a pivotal time in our history. And without community doing this together, we'll never see the other side. And also use your voice and letting people know what you've seen in the hospital. Humanize the experience. Let them know that this catastrophe cannot stop us. So I utilized a vaccination parade and founded the Crew of Vax, which is a Mardi Gras theme, which is special to Louisiana. I'm a Louisiana nurse. And the Crew of Vax galvanized nurses. We consulted with educational leaders and governmental leaders on what we did see in the hospital, coming from a voice that did zip up the body bags, a voice that understand both sides in the community and in the hospital. And the Crew of Vax, we partnered with Oshner Healthcare team, and we had vaccination parades to vaccinate as many people as we can. And other people were welcomed into the vaccination parade who may not have been ready to be vaccinated, but they did leave with an awareness, and they did leave with an understanding that testing is important, and also wearing masks are very important. That has been one of the most pivotal times in my life over the past year. I am very proud to say that I stand on the side of nurses, strong nurses such as yourselves who are watching or who will come on to watch later. And thank you for your service, and just continue the hard work. We're still in the fight, but guess what? There is light at the end of the tunnel. And the next slide will just briefly show about community leadership. Is really about community service, and it just kind of shows pictures of different things that has happened in the community, through my community service. Thanks to Gifted Healthcare, I was a part of a leadership institute that equipped me with great tools and knowledge on how to be a more effective and efficient leader. And that through New Orleans Regional Leadership Institute, I won the Community Service Award, which I was very proud of. And also, frontline workers were invited to the White House for 4th of July, celebrating our work during the pandemic. And I was very proud to be there. And I just encourage everyone to, step up in community and lead and use your trusted voice and your leadership to continue to make a difference, not only at the bedside, but beyond the walls into our community. In the next slide, we will talk about nurse burnout and other things that I do to combat nurse burnout. And that is leisure travel. Everyone loves leisure travel, experiencing new cultures, experiencing new communities. To me, it promotes the great work-life balance. And it is the way that I get away from the world, and I just turn in and focus on myself and the things that I enjoy. And I think on the next slide, we'll talk about the Nurse Travel Network. A lot of you may already know about the Nurse Travel Network. They're very popular on Instagram, but I joined their group and we went to Thailand in November 2019, which was one of the best experiences that I've ever had. It's an organization that curates trips, luxury trips only for nurses. Nurse influencers are there. Katie Duke was there on that trip with me. She taught us so many things about, just nursing and wellness and the importance of tuning in and taking care of yourself and pouring into your own cup before you pour out into others. She gave great insight on fulfilling purpose and calling. And not everybody's calling and purpose is the same, but it all comes together to make a better society. And that trip was just mind-blowing. It was life-changing, and one of the best experiences that I've ever had. I was able to meet nurses all over the United States. We all talked about different experiences that we have. We also talked about barriers and obstacles and ways to overcome those obstacles that we face in our career. And other trips that I take during our breaks when I'm not travel nursing, we offer with Braveheart Foundation after our missions trips, we offer leisure trips after to some country near Uganda. The last country we went to was Mombasa, Kenya. And it was just great going out on the beach and learning cultures from surrounding countries that we have served. I will open the floor up for any questions if there are any questions. But if you would like to connect with us, we are on Instagram, Braveheart Foundation. Our website, I'll put in the chat. You can get with us on our website. If you would like to get with me, you can also go through this website, subscribe to the email, or just send an email. I would like to connect with you guys to give insight on travel nursing and choosing a great agency. Gifted Nurses, Gifted Healthcare are all about nurses. The CEO of the company, she is a registered nurse, so she has a heart for nurses. And this group really catapults you into different things and gives you opportunities that you never thought that or imagine that you can experience. And that I will be forever grateful for. And any other questions related to community service, community health, public health, international health. I'm a wealth of knowledge related to that, and I'm open to answering any questions related to.
I'm going to hop back on. I do have a question too. How long do you normally go on your mission trips? Is it usually pretty like 2 weeks, or what's maybe the longest that you've done?
So typically we do 14 days. We'll do 2 days in the beginning for travel, of course. We'll do 10 days on mission goals, and we'll do 2 days on the back end just for travel. And if anybody is interested in experiencing the leisure part of the trip, we typically tack on another 5 to 7 days for that part.
Oh,
But
nice.
that's separate from the mission.
Nice. Yeah, if anybody has any questions, feel free to put it in the comments. And if you're watching this later, still put it in the comments and we'll get them to Erica, or you can visit her website, follow her on Instagram and ask her. Like she said, she has tons and tons of knowledge. So she's an open book. She'll be happy to help you guys.
Yes, most definitely.
Well, Erica.
Yeah, and if no more questions, again, Rachel, I thank you and the Gypsy Nurse, and also Gifted Healthcare for sponsoring this segment. And I look forward to meeting other Gypsy nurses and other nurses in our community.
Yes, thank you so much again. Thank you, Gifted Healthcare, for introducing us to Erica and having her come on here. It's been amazing. So please reach out to her. She does amazing, amazing things. So yeah, thank you so much, everybody.